Hello and welcome back to this series of videos introducing the missed opportunities for vaccination application. I'm Caitlin Clary with Biostat Global Consulting. This is the fourth video in this series where we'll discuss the requirements for a dataset to be compatible with this tool. In the first video in this series, we discussed the MOV output from the Vaccination Coverage Quality Indicators Program, or VIQI. The MOV application was built to work with datasets that VIQI produces, which have information from child-based MOV analyses. But you don't have to run VIQI in order to use this tool. Other coverage survey datasets can be used as long as they're in the right format and have the necessary variables, which is what this video is going to cover. Coverage survey data that has each child's dates of vaccination can be used in combination with a national vaccination schedule to determine the doses each child was eligible for each time they had a vaccination visit at a health center. Using that information, you can evaluate whether there were missed opportunities for simultaneous vaccination at those visits and whether the missed opportunities that did occur were corrected or uncorrected by the time of the survey. You can refer to Chapter 6 and Annex O of the WHO's Manual on Vaccination Coverage Cluster Surveys for guidance on calculating those visit and MOV variables. The link to that manual is on this slide, and it's also in the description underneath this video. For a dataset to be compatible with this application, it should have one row per respondent, and the application also looks for variables with specific names in order to summarize outcomes. The first of those required variables is an identifier of Level 3 strata, which can be called either Level 3 ID or Level 3 name. Level 3 strata are typically the lowest administrative level at which survey results are designed to be representative. So Level 3 could be health districts or cantons or states or some other geographic division, depending on the survey. We talked about geographic strata and the level variables in VIQI in the first video in this series if you'd like more information. The next required variable is a total eligible visit counter that tallies how many times each child visited a health center and was eligible to receive at least one vaccine dose at that visit. You'll notice that this variable can have the suffix crude or the suffix valid. We've discussed in earlier videos that the VIQI software and this MOV tool have two main ways of tallying vaccination eligibility and coverage. The difference between those crude and valid methods has to do with how early vaccinations are handled. So for instance, if a child is eligible to receive a vaccine once they turn 6 weeks old, but the child receives that dose when they're only 4 weeks old, how is that early vaccination handled? Crude calculations say that early doses count. Once a child receives a vaccine, even if the timing isn't quite right, we still count that vaccination as received. Valid calculations, on the other hand, don't count early doses. So a child who gets a dose early is considered to have not received that dose because it wasn't given at the right time. So in our example, where this 4-week-old child receives a dose that they weren't supposed to get until they were at least 6 weeks old, once that child turns 6 weeks old, they would be considered eligible to receive that dose again now that they're old enough under the valid method of accounting. If you did crude MOV calculations, then the dataset should have variables with the crude suffix. And if you did valid MOV calculations, the variables should have the valid suffix. If you do both sets of calculations, then your dataset can have a crude set of variables and a valid set of variables. In that case, the application interface will give you the option to decide whether to look at the crude results or the valid results in plots and tables. Moving down our list of required variables, for each dose in the dataset, there should be a variable that counts how many health center visits a child had when they were eligible for that dose in particular. And the tool uses these total elig dose variables to identify the names of the doses in the dataset. So if your dataset has these 5 variables, tallying total visits when eligible for BCG, total visits when eligible for Hep B0, and so on for Penta 1, Penta 2, and Penta 3, then the application will detect that these 5 doses are the doses in the dataset, and will use those variable names to construct a dose list. For each of those doses, there should also be a dichotomous variable that flags if the child had a missed opportunity for that specific dose during any of their visits. If the child did have a missed opportunity, then that MOV is either corrected or uncorrected by the time of the survey. So the MOV tool looks for a corrected MOV flag and an uncorrected MOV flag. If a child has an MOV for a particular dose, so has the flag had MOV variable set, then either the flag corrected MOV or the flag uncorrected MOV variable should be set. And the corrected and uncorrected variables are mutually exclusive. So let's quickly illustrate how some of the variables in your dataset might look if you did crude MOV calculations, looking specifically at the variables related to the BCG vaccine. Each row in this dataset represents one child. We have a variable showing which level 3 stratum the child is from, a counter of the total number of visits the child had to a health center when they were eligible to receive at least one vaccine, and then a counter of eligible visits for BCG alone. Next, we have the indicators for whether the child had a missed opportunity for BCG, and if so, whether that missed opportunity was corrected or uncorrected. A coverage survey dataset usually has data on many different vaccines, so this set of visit and MOV variables would be repeated for other doses. Maybe you'd have a set of variables for hepatitis B, for Penta 1, and so on. Here, the visit and the MOV variables have the suffix crude, indicating that early doses were counted in these calculations. Here's another quick example with valid calculation variables, and this time we're looking at the dose MCV1 instead of BCG. Because these variables represent valid calculations, we have the valid suffix, and because these variables are associated with the MCV1 vaccine, that dose name appears in the middle of these variable names. So that's an overview of the required variables for a dataset to be compatible with this tool. There are a few additional variables that are optional when you're using the MOV application, but which can be useful. The application can summarize how long it takes for MOVs to be corrected, as long as, for each dose in the dataset, there's a variable that counts the days between the initial missed opportunity and the health center visit when the dose was ultimately received. If these days until correction variables are present, then a time to correction tab in the application will be populated with a figure and a table. And then, in addition to the level 3 stratum variable, which is required, you can also provide a level 1 stratum variable. This would usually be the country's name. There's only one level 1 stratum in the dataset. And then you can also provide a level 2 stratum variable to identify subnational strata between level 1 and level 3. Including the level 1 and level 2 stratum identifiers in your dataset will let you explore different levels of aggregation when using the application. To wrap up here, we'll take a quick look at an example dataset that would be compatible with the MOV tool. This dataset has level 1, level 2, and level 3 stratum identifiers. And then it has a set of variables using crude MOV accounting. The first of these is a counter of the number of visits that each child had to a health center when they were eligible for at least one vaccination. And then we have a set of variables specific to the BCG vaccine. The counter of eligible visits for the BCG vaccine, a flag for if the child had an MOV, and then flags for whether that MOV, if it did occur, was corrected or uncorrected. For kids who did have a corrected MOV for this dose, we have a counter of days until correction. And then this set of dose-specific variables will be repeated for the other doses in our dataset. Penta 1, Penta 2, Penta 3, MCV, and then we'll move into a set of variables using valid MOV accounting. Again, we have a total eligible visits counter, a dose-specific eligible visits counter, flags for MOVs and whether those MOVs were corrected and uncorrected, and a days until correction variable. And that set of dose-specific variables is repeated for each of the doses in our dataset again, the Penta series and MCV1. The variables that we've talked about in this video are the variables that the MOV tool works with in order to produce output. But you can upload datasets that have other variables as well. The MOV tool will ignore any variables that don't have a name that it recognizes. And that brings us to the end of our discussion of datasets compatible with this application. Thank you for listening.